My name's Olivia Swann and I'm a children's doctor and a data scientist, and I work with children who have infections. And this is all, the study that I've started was all kind of stimulated by meeting patients in the emergency department. And I realised that I was seeing the same children again and again. And they were coming in with chest infections or with wheezy episodes. And their parents were telling us one of two things: either that their homes were cold and damp and they couldn't afford to heat them, or in some situations that they'd had a retrofit and then things had got worse. So that was what set me on this path. So I have since then learned a huge amount, but not as much as many people, about building physics, about the kind of standards that we have, the standards that we need. So the study that I'm running is the Homes, Heat and Healthy Kids study. It's a 5-year-long study looking at the impact of cold, damp homes on preschool children, so children under 5, and their risk of chest infections, but also looking at how the different ways that we heat homes or that we make them warmer, actually impacts the risk of chest infections, and that's to do with the way that they've been retrofitted and the resultant air quality. As I'd previously said, I make no apologies for the fact that I think kids are the most important, but they really are. So what I'm looking at particularly is children under 5, so preschool children who aren't being protected by their school environments yet, so they are even more at risk of their home environments. And as you say, children, there's a number of things that make children more vulnerable. So their respiratory systems and their immune systems are developing, but also they breathe really fast. So kids breathe a lot faster. If you've got young children, just look at them and watch. Compared to how we as adults breathe, is probably about kind of 12, 15 breaths a minute. Some brand new babies will normally be breathing 60 times a minute. So they take in a lot more of the air that's in their home. We also know that it's not just a fact of a one-off chest infection or a one-off wheezy episode, that actually that can have lifelong impacts. And if you have respiratory infections as a small child, it increases your risk of asthma as an adult, and actually also increases your risk of dying from a respiratory problem later on as an adult, regardless of if you smoke and regardless of your socioeconomic status. So it really sets you up for your lifelong health. So we need to be thinking about this in a longer term output, and also if you want to move away from the kind of fluffy paediatric side of things, thinking about the cost, thinking about how much more it costs if somebody's lungs are set up to be unhealthy throughout their life, so how much more time they spend in the NHS. Yeah, I think that's a good word for it. I think cross-sectoral or interdisciplinary or whatever you want to call it, but it's so exciting to bring so many different people together, and I think that is something that this area is actually really good at, is collaboration. So I feel very strongly that we need to get health and housing out of their silos. The people who I've spoken to in this project have been so receptive, and everybody's on the same page and wanting to work together. So the project is bringing together a huge amount of different skills. So we have from the nuts and bolts of the data linkage, and that's linking up the healthcare and the housing data across Scotland, to the complex analyses, to the building physics models, to the indoor air quality measurements, to the policy translation to make sure that we can actually turn findings into policy outcomes. So it's a really exciting group, and as I said already, we have a meeting coming up which I expected to be about 20 people and some sandwiches, and actually it's turned into 130 and 50 different organisations. So there is so much appetite for people working together, which is just wonderful. Absolutely, and I feel massively passionate about that side of things, and I feel very honoured that this group of families are willing to share their experiences and their stories with us, because it's a very private. It can be quite a lot of stigma attached to your home, particularly when you start talking about childhood and when you start talking about the impact of a home on a child's health. It can be quite personal. So I'm so grateful for them sharing their expertise, and it has really been a kind of journey together in terms of proper co-production of this study. So making sure that we were asking the questions right from the beginning that were important to them, and making sure as well discussing the ways of linking all of these data sets together, because that is a key part of this study. This is the first time ever in Scotland that we can link healthcare data with individual homes. And that is so exciting because it allows us to see those associations in a really detailed way. But it's really important that we take the public with us and that they understand why we can do that, or why we are doing that, and what the benefits are, and of all the steps that are being undertaken to keep it really safe. So we've all those different steps have made sure that that it's acceptable to them what we're doing. So we've got the questions that they want answered in a way that they want them answered. And as I said as well, they have co-produced this great animation outlining the problem of cold homes and respiratory infections in kids, outlining the study, and then pointing people to places for support. And they've used that to gain qualifications. So they've used that to gain the Community Leadership Qualification SQF Level 5. So we're finding ways to really meaningfully acknowledge their expertise beyond just a voucher for participating. So they're awesome. They're just brilliant. There is so much data, and I think that's it's almost like having a washing line that you can peg different data sets on. So we've now got this link, as I say, between children's healthcare data and every home they've ever lived in across Scotland. And now we can peg on additional data sets that are to do with those individual homes. As you say, that could be smart meter data, it could be sensor data. The data set that we're bringing together, the underlying data set, is from 2008 to 2025 for all children under 5 across Scotland, so 4 million child years and about 250,000 homes. So over that period of time, not all those data sets are available, obviously, because some of the smart data is only available more recently. So we'll have, for the whole data set, we'll have more of the traditional routinely collected data throughout the whole thing. But actually for the last couple of years, we'll be able to see by adding in the smart meter data, validating it with indoor sensor data, and also high street banking data. Again, that's not at the property level, but information on how much is being spent on energy in an area, for example. Adding all of that in to the traditional data to see what other insights that brings. So it's so exciting.